Indigestion, reflux, heartburn, we've all been there, right? That really uncomfortable, burning feeling after a big meal. But what if it's more than just, a passing thing? Today, we're going to unpack dyspepsia and reflux and really dig into when this super common problem needs a much, much closer look. So let's dive in. And this is the million-dollar question, isn't it? It's so easy to just dismiss that bloating or that burning sensation, but figuring out the difference between a temporary discomfort and a real signal from your body, well, that's absolutely crucial, and that's exactly what we're going to break down today. Okay, first things first, let's get the language right. You probably call it indigestion, but your doctor, they're likely going to use the word dyspepsia. It's basically the medical umbrella term for that persistent pain right in your upper gut. Think of it as a stomach discomfort itself. Reflux, on the other hand, is more that feeling of acid coming up into your throat. They can definitely happen together, but they're not exactly the same thing. Just knowing this term is a great first step. Now, let's get to what is maybe the most critical part of this entire explainer. Dyspepsia itself is incredibly common, we know that. But there are certain symptoms, what doctors call red flags, that you should never, ever ignore. These aren't just annoyances. These could be urgent signals that your body is sending you. Okay, let's take a close look at this list. This isn't meant to scare you, it's meant to empower you. So, difficulty or pain when you swallow. That's a major flag because it could mean there's a physical blockage. Unintentional weight loss, that's a sign your body is burning through a ton of energy, and we need to know why. And things like vomiting that just won't stop, any sign of blood, or unexplained iron deficiency, those are immediate signs that something is wrong. If any of these sound familiar, it is time to call your doctor. Now, this is a really interesting and important distinction. True dysphagia, the red flag, means you are having significant physical trouble getting food or liquid down. That's totally different from what some doctors call faucet, which is more that general annoying feeling like you've got something stuck in your throat. While that feeling is no fun, on its own, it's not considered the same kind of alarm bell. It's a subtle difference, but for a diagnosis, it's vital. The alarm bells can also point towards another organ, the pancreas. The signs here are a bit different, but they are just as important. Painless jaundice, that's when your skin or the whites of your eyes turn yellow, that is a major one. It can mean something is blocking a bile duct, and the pancreas sits right there. When you see that, especially combined with serious weight loss or new back pain, that warrants an urgent medical evaluation. So, if we've rolled out those really serious red flags, you might be thinking, okay, what else could be causing all this discomfort? Well, for a huge number of people, the answer is a tiny hidden culprit. Let's talk about a type of bacteria called H. pylori. 50%. Just let that number sink in for a second. We are not talking about some rare infection here. That's the estimated percentage of the entire world's population that's infected with H. pylori bacteria. It lives in the stomach lining and, a lot of people carry it without any problems at all. But for others, it's a major cause of dyspepsia and even stomach ulcers. So who actually needs to get tested for this? Well, this guidance makes it super clear. Testing is for people with that classic upper abdominal pain, that dyspepsia we talked about. But it's not something doctors just do for everyone who has classic reflux symptoms, like only heartburn. It really shows how medicine is targeted and based on evidence. And if that test comes back positive, what's the game plan? Well, the standard treatment is a really powerful 7-day course called eradication therapy. And this slide shows us exactly what that is. It's a 3-pronged attack. You've got a proton pump inhibitor, or a PPI, to cut down on stomach acid, and then you hit it with 2 different antibiotics to hopefully wipe out the bacteria for good. Okay, so whether the cause is H. pylori or something else entirely, the next question is always, so what do we do about it? Let's shift gears and talk about the actionable stuff, what you and your doctor can do to manage these symptoms. Welcome to your management toolkit. The best way to think about managing all of this is as a partnership. It's a team effort. As you can see here, there's your role, which is all about lifestyle changes you can start making yourself. And then there's your doctor's role, which is providing the necessary medical treatments. Both are absolutely essential to getting things under control. So, what's in your power to change? A surprising amount, actually. This table lays out some things that can be incredibly effective. I mean, even losing a little bit of weight can physically reduce the pressure on your stomach. Quitting smoking is huge because it can actually strengthen the very muscle that's supposed to stop acid from coming back up. And keeping a food diary. That's not about restriction, it's about information. It's about taking back control. All right, let's move on to the final piece of the management puzzle, medication. These are powerful tools for sure, but it's so important to be an informed patient, to really understand how they work, why they're being prescribed, and what you need to think about for the long term.
Ooh, I love this analogy for treating reflux. It just makes so much sense. Think of it just like modern asthma treatment. A daily PPI like omeprazole, that's your preventer. It's working in the background day in and day out to control acid production. Then, something like an antacid, that's your reliever. You just use it as you need it for any of those breakthrough symptoms that pop up. It's a really brilliant and effective strategy.
Now, while these PPIs are super effective, doctors are always mindful of potential long-term risks. This simple BBC mnemonic is a great way to remember them. There's a risk of B12 deficiency, potential effects on bone health from lower calcium absorption over time, and a slightly increased risk of a gut infection called C. diff. This is all about having an open conversation with your doctor to balance the benefits and the risks for you personally.
And that really brings us to the end. It all comes back to this one simple idea. Indigestion and reflux might seem like small stuff, but they are signals. They're your body's way of communicating with you. Knowing how to read those signals, when to make a lifestyle change, and when it's time to get medical advice, that's the key. So I'll just leave you with this question. Your body is talking. Are you ready to listen?